You've been lied to. Not by a doctor, not by anyone with bad intentions, but by the silence of your own body. And that silence is costing you, possibly everything. Here's the truth that keeps me up at night as a kidney specialist. Right now, as you're watching this, 9 out of 10 people with chronic kidney disease have absolutely no idea. No pain, no swelling, no warning. Their kidneys are quietly failing month after month, while their morning feels completely normal. And by the time they find out, they've already lost kidney function they will never ever get back.
I'm Dr. Faviemo, a nephrologist with over 10 years of clinical experience, treating patients from the earliest stages of silent kidney damage all the way to dialysis. And I'm going to tell you something in this video that your doctor has almost certainly never told you, not because they don't care, but because a 7-minute clinic appointment doesn't leave room for it. What do you drink in the first 30 minutes of your morning is either protecting your kidneys or slowly destroying them. And most of you are doing it wrong every single day. There are 4 specific drinks, backed by real clinical research. Each one costs almost nothing, no prescription needed. You can make all 4 in your own kitchen in under 3 minutes. And drink number 3, it surprises every single patient I tell it to. Stay with me, because by the end of this video, your morning routine will never be the same. But first, you need to understand what's actually happening inside your kidneys right now. Because without this, the 4 drinks won't make complete sense. Most people think kidney disease is obvious, like a broken arm. Either something's visibly wrong or you're fine. The idea that your kidneys could be running at 50% or 60% capacity while you feel perfectly normal is genuinely hard to accept. But that's exactly how chronic kidney disease works. It's not a dramatic event. It's a slow, invisible erosion. Your kidneys filter 200 liters of blood every single day. They remove waste products, toxins, excess minerals, medications your body has already processed. They regulate your blood pressure. They signal red blood cell production. They activate vitamin D for your bones. These are not lazy, passive organs. They are among the most metabolically active, relentlessly working organs in your entire body. And after 60, they're already under more pressure than they were at 40. Blood vessels inside your kidneys stiffen. The number of functional filtering units, called nephrons, decreases with every decade. This is just biology, but it means your kidneys have a much smaller margin for the daily insults most people never think about. Chronic dehydration, blood sugar spikes, inflammation, each one chips away at function that cannot be rebuilt. Here's the number that should stop you cold. According to the National Health and Nutrition Examination Survey, approximately 40% of adults over 60 meet the clinical definition for some stage of chronic kidney disease. 40%. That's not rare. That's nearly every other person in a room, and 9 out of 10 of them have no idea. I want to tell you about a patient I'll call Raymond, 67 years old, retired civil engineer, meticulous man. He exercised 4 times a week, watched his sodium, cooked at home, took every medication on schedule. By every standard measure, Raymond was doing everything right. He came to me after routine blood work flagged a slightly elevated creatinine level. When I ran his full kidney panel, his GFR, the key measure of how efficiently his kidneys are actually filtering blood, had dropped to 54. Normal for his age should have been above 75. He had stage 3 chronic kidney disease and had absolutely no idea. I asked him to walk me through his morning routine, and then I asked the question most doctors never ask. What are you drinking from the moment you wake up until noon? His answer, 2 large black coffees, first thing, then nothing until lunch, when he'd have sweetened iced tea. Occasionally, a sports drink on hot days. Raymond was not drinking water in the morning. For years. He was starting every single day in a state of mild dehydration. His kidneys were beginning each morning already under stress, already working harder with none of the flushing support that proper hydration provides. We made specific changes to what he drank in the morning, that's it. Within 6 months, his creatinine stabilized. His GFR stopped declining. He was no longer trending toward dialysis. He just needed information no one had ever given him. That conversation is the reason this video exists. Here's why the morning matters more than any other time of day. While you sleep, your body goes 7 to 8 hours without fluid. Your kidneys don't rest. They keep filtering all night. But without incoming fluid, they start concentrating urine more and more aggressively to conserve water. Blood thickens. Waste products build up in higher concentrations. By the time your alarm goes off, your kidneys are in what I call the morning stress window. Blood is at its thickest. Filtration demand is at its peak. Urea, creatinine, uric acid, all sitting at their highest concentration of the entire day. And if the first thing you give your kidneys is coffee, which is a diuretic that stimulates fluid loss rather than providing hydration, you're extending that stress window by another hour or two before real hydration ever arrives. Think of a healthy river. It flows freely, carries waste downstream, keeps its banks clean. Now think of a drought-stressed river. It slows. It concentrates everything it carries. It deposits sediment. It damages its own bed. Every morning, without proper hydration, your kidneys are that drought-stressed river. And 4 specific drinks can change that, each through a completely distinct biological mechanism. Before I walk through all 4, I want to ask you something, and I genuinely want your answer in the comments below. What is the very first thing you drink every morning? Coffee? Tea? Water? Something else? I ask this question at every first appointment. The answers reveal patterns that no blood test ever shows. Tell me below. Drink number 1, warm lemon water. The mechanism here isn't simply that lemon is healthy. It's a specific compound called citrate. Lemon juice is the single highest natural dietary source of citrate among all citrus fruits. And citrate performs a precise, documented function inside your kidneys that nothing else replicates. Waste products in your urine, particularly calcium and oxalate, cluster together to form crystals. Those crystals grow into kidney stones. But even before they reach stone size, those microcrystals grind against the delicate inner walls of your kidney tubules, causing inflammation and scarring. Citrate binds directly to calcium ions in your urine and stops that clustering before it ever starts. A study from Duke University Medical Center, replicated in a 2021 clinical trial published in eClinical Medicine, found that regular lemon juice supplementation significantly increased urinary citrate levels and reduced kidney stone recurrence. The National Kidney Foundation now formally recommends lemon water as a preventative measure. How to prepare it? Squeeze the juice of half a fresh lemon into a glass of warm water. Not cold, not boiling. Warm water absorbs faster. Drink it before your coffee, before anything else, first thing. This timing matters because your urine is most concentrated and most acidic in the morning. That's exactly when citrate's protective effect is most needed. And do not add sugar. Sugar raises blood glucose, which increases harmful compound concentration in your urine, the exact opposite of what you're trying to achieve. Drink number 2, plain water, but the timing and amount are everything. I know. Water. Obvious. But I'm including it specifically because of how my patients drink it, which is almost universally wrong. Most people drink water reactively, only when thirsty. After 60, your thirst mechanism is measurably less reliable than it was at 40. You will not always feel the dehydration that's happening. Research published in the journal Medicine found that higher volume water intake was directly associated with lower risk of albuminuria, which is protein leaking into the urine, one of the earliest measurable signs of kidney damage. A cohort study in nephrology dialysis transplantation confirmed that patients with chronic kidney disease who maintained consistent daily water intake were significantly less likely to progress to kidney failure. After your lemon water, drink a full 8-ounce glass of plain water before you do anything else. This rehydrates your blood, thins your morning urine concentration, begins flushing the overnight buildup of waste, and reduces your kidney filtration workload within 20 to 30 minutes. One measurable sign that this is working. Your first urination of the day should transition over 2 to 3 weeks of consistent morning hydration from dark yellow to a pale straw color. Dark yellow every morning is your kidneys telling you they are overworked. Pale yellow is them telling you they finally have what they need. Drink number 3, unsweetened green tea. This is the one that surprises my patients most, and it carries the most underappreciated science of all 4. Green tea contains a specific class of antioxidants called catechins. The most powerful among them is EGCG, epigallocatechin or 3-gallate. This compound does something inside the kidneys that no other common beverage compound does. It directly inhibits nucleation, the initial step where mineral crystals begin forming in kidney tubules. Multiple laboratory studies confirm that EGCG prevents calcium oxalate crystals from forming and actually stops them from adhering to tubule walls, which is the step that causes irreversible scarring. Beyond stones, green tea's anti-inflammatory properties work against the chronic low-grade inflammation that is one of the primary drivers of kidney function decline in older adults. A 2022 Mendelian randomization study found a direct causal link between tea consumption and better kidney function outcomes. A prospective cohort study of middle-aged and elderly adults found that regular green tea intake was associated with significantly reduced kidney stone incidence. Critical preparation detail. You must brew it from actual leaves or whole leaf bags, not pre-bottled green tea drinks. Those contain added sugar and have minimal catechin content due to processing. Brew 1 cup at 80 degrees Celsius, not boiling. Boiling water degrades EGCG significantly. Drink it in the morning after your water. 1 cup per day is the optimal dose. 2 is acceptable. More than that, in older adults with any kidney compromise, is unnecessary, and the caffeine load starts to offset the benefit. Drink number 4, diluted unsweetened cranberry juice. Cranberries have a reputation for urinary tract health, but most people don't understand the precise mechanism, and most people consume it in completely the wrong form. Cranberries contain compounds called proanthocyanidins, specifically type A proanthocyanidins. These compounds do something structurally unique. They prevent bacteria, primarily E. coli, the most common cause of urinary tract infections, from adhering to the walls of your urinary tract. They don't kill bacteria. They make your urinary tract surfaces literally too slippery for bacteria to grip. Why does this matter for kidneys specifically? Because recurrent urinary tract infections are one of the most common and most under-recognized causes of kidney damage in older adults. Each untreated or undertreated UTI sends bacteria upstream. Repeated kidney infections, called pyelonephritis, cause tissue scarring that never repairs. Protecting the urinary tract from bacterial adhesion is very directly protecting kidney tissue from cumulative permanent scarring. A 2024 systematic review and network meta-analysis published in European Urology Focus confirmed that cranberry products reduce UTI recurrence in susceptible populations. For older adults, particularly women over 60 who face the highest UTI risk, This is clinically meaningful protection. The critical detail: you must use pure unsweetened cranberry juice. Not cranberry cocktail, not cranberry blend, not sweetened cranberry drink. Those contain so much added sugar, they actively worsen kidney health. Pure unsweetened cranberry juice is intensely tart. Dilute 2 ounces in 6 ounces of water. Drink it once daily in the morning. That 2-ounce dose delivers the proanthocyanidin concentration the research supports without overloading your system with sugar or excess potassium. If you have established chronic kidney disease at stage 3 or beyond, speak with your nephrologist before adding this one, as the potassium content may require monitoring. Raymond came back to see me 8 months after that first conversation. His GFR had improved from 54 to 61. Not a dramatic reversal. Kidney function rarely reverses dramatically, but a real measurable stabilization and modest recovery. His creatinine was down. His urine protein had normalized. He was no longer trending toward dialysis. The first thing he said when he sat down was not about his numbers. He said, "I've been waking up every morning for years, and nobody ever told me that what I drank in the first 30 minutes was this important." He was right. He'd had access to all 4 of these drinks his entire adult life. They cost almost nothing. No prescription, no side effects, no specialist referral. He just needed someone to connect the science to the morning routine he was already living. You are that person now. Here are the 4 drinks, in order, every morning. First, warm lemon water. Half a fresh lemon squeezed into warm water before anything else. Citrate blocks crystal formation in your tubules and reduces stone risk. Second, plain water. A full 8-ounce glass immediately after. Rehydrates your blood, thins your morning urine, drops filtration workload before the day begins. Third, 1 cup of unsweetened brewed green tea. Catechins protect kidney tubule cells from oxidative damage and prevent the crystal adhesion that causes irreversible scarring. Fourth, 2 ounces of pure unsweetened cranberry juice diluted in water. Proanthocyanidins coat the urinary tract and prevent the bacterial adhesion that leads to repeated infections and cumulative kidney scarring. None of these require a prescription. None cost more than a few dollars a week. All 4 are backed by published clinical research. Now here's my question for you, and I genuinely want your answer in the comments. Which of these 4 are you already doing? And which one surprised you most today? Your answer may be exactly what another viewer needs to hear to finally take action. If this gave you something real, share it. Not for the channel. For the person in your life who's over 60 and has never once thought about what they're drinking in the first 30 minutes of their morning. That person may not know they need this yet, but you do. Subscribe, because next time we're talking about 5 common medications that millions of people over 60 take every single day, not knowing they're silently damaging their kidneys. You will not want to miss that one. And one final thing, everything I've shared today is based on published research and my clinical experience as a nephrologist. But your situation is unique. Your kidney function, your medications, your history, these all matter, and I don't know them. Before making any changes, especially if you have established kidney disease, please speak with your own doctor. They know your numbers. I know the research. Together, you can build a morning routine that actually protects the organs that protect you every single day without ever asking for anything in return. I'm Dr. Faviemo. Stay consistent, stay informed, and take exceptional care of the organs that have been quietly taking care of you your entire life. I'll see you in the next one.